of Health's laboratory. Confirmatory monkeypox testing at the U.S. Centers for Disease Control and Prevention is currently pending. What I want to emphasize strongly at the outset is that monkeypox does not spread easily between people. And so the risk to Ohioans generally is very low. This disease is not like COVID-19, which, as we know, can be spread easily from person to person through the air over several feet in space. In contrast, monkeypox spreads between people primarily through direct contact with infectious sores, scabs, or body fluids. It also can be spread by respiratory secretions during prolonged face-to-face contact. Monkeypox, for example, can spread during intimate contact between people, including during sex, as well as activities like kissing, cuddling, or touching parts of the body with monkeypox sores. The Ohio Department of Health is working very closely with the CDC, relevant local public health authorities, and the affected patients' healthcare providers to ensure appropriate care for the patient. The case patient remains isolated and is following recommendations from public health and their medical providers. To protect the resident's privacy, the Ohio Department of Health will not be providing further details about this patient. Now, the Ohio Department of Health strongly recommends that anyone who's experiencing symptoms of an unexplained rash, including lesions on any part of the body, contact a health provider as soon as possible. People who are feeling ill should, of course, stay home unless seeking medical care. Monkeypox is a viral illness that typically begins with flu-like symptoms and swelling of the lymph nodes, progressing then to a rash. However, cases recently identified across the country appear less likely to have the initial constitutional symptoms of flu-like illness or lymph node swelling before the rash, which may look like pimples or blisters, and may also stay contained to a particular part of the body. Now, it's important to note that anyone can get monkeypox, even though most cases associated with the investigation in the United States have occurred among men who have sex with men. To date, the CDC has confirmed 49 cases in the United States. Worldwide, there have been nearly 1,500 cases confirmed, but no deaths reported. So again, while we do have a probable case of monkeypox here in Ohio, it's important to note that because the disease is not easily transmitted, there is very little risk to the general public. Thank you, and we now have time for questions. Ken?
Thank you, Dr. Vanderhoff. Our first question is from Joe Ingles, Ohio Public Radio and Television.
Good afternoon.
Good afternoon. So let me ask you, monkeypox, you said, cannot be transmitted easily. Is there reason to believe, though, that it's transmitted quickly? And do you see this first case as just, like it's going to happen more and more? Or what can we expect in the future?
Well, what we know very well about monkeypox is that, as I said, it's not easily transmitted. It requires very close contact between two individuals for the spread to occur. In terms of what we can expect heading into the future, well, there are a lot of ifs in terms of what we can expect. Certainly, our public health efforts nationwide and worldwide are aiming to isolate all the cases that we can find in an effort to contain and limit the spread of monkeypox between people. So we'll have to wait and see about how that effort proceeds. But there are two very important components to that effort. First is people being aware of the risk of monkeypox and the medical community being aware and knowledgeable about the potential risk of monkeypox and looking for it when they are examining people who present with the potential rash or other signs or symptoms of monkeypox. To that end, a great deal of education has been undertaken both nationally and here in the state of Ohio. And we feel very confident that the medical community is well prepared and well able to look for the condition and do appropriate testing when necessary.
Okay, our next question is from Justin Dennis with Mahoning Matters.
Dr. Vanderhoff, thanks for talking with us. Is there any indication how this person contracted the illness, any recent travel, or anything that might suggest how this happened?
Yeah, so I am not going to go into any details regarding the particular case beyond what I have shared thus far. However, I can say that there is nothing unusual or atypical about this case in comparison to other cases that have been observed across the nation and across the world. And I would point back to my comments regarding how the disease is communicated from one person to another, how it's spread. This is a disease that requires very close, generally very intimate contact between people.
Okay, our next question comes from Samantha Hendrickson of the Associated Press.
Hello, thank you, Dr. Vanderhoff, for speaking. I'm just wondering, you said probable. Are there any additional tests or a testing period that will take place in order to confirm that it is monkeypox?
Yes. So thus far, the Ohio Department of Health's laboratory has conducted a test for the orthopox family of viruses that this virus falls into. The confirmatory, very specific PCR test for monkeypox is in fact performed by the CDC. And that is the test that we're waiting for in terms of confirmation. So this is now classified as a probable case, and we are awaiting confirmation from the CDC laboratory before we would call it a confirmed case.
Okay, we don't currently have any other questions in the queue. We have another minute or two. If there are any other questions, please indicate so now. If not, then we're going to thank you again for joining us. And Dr. Vanderhoff, do you have any closing remarks?
No, thank you very much for taking the time to join us this afternoon, and we will certainly communicate further information as needed.
This concludes